Okay, the rocket gets launched. Huh?
Anisha, we are live.
Good evening and welcome to ISW Council's special web series Blood Connect, all that you want to know about anemia. This show is supported by Shilpa Medicare. Now, anemia is widespread in India. 58.6% of children and more than 50%, nearly 53.2% of non-pregnant women and nearly half of pregnant women were found to be anemic in 2016. Now, India carries the highest burden of the disease despite having an anemia control program which has been running for the last 50 years. Anemia is a condition in which a person has insufficient red blood cells or the quantity of hemoglobin, which carries the capacity of, which is actually the capacity of blood to carry oxygen across the body. The hemoglobin is lower. Now, the normal hemoglobin in women is about 12, and for men, it's 30. And when this is much lower, we have a problem of anemia. Now, anemia doubles the risk of death during pregnancy for women, which is actually pregnancy and childbirth. It also leads to poor motor and mental growth in children. And it does lower productivity in adults. And, some estimates say it could cause a loss of up to 4% of the gross domestic product of our country. So in economic terms also, anemia has a huge cost for our country. Now, why do people have anemia? Inadequate dietary intake of iron, defective iron absorption, increased iron requirements due to repeated pregnancies and lactation, poor iron reserves at birth, and frequency of infections in children, and excessive physiological blood loss during adolescence and pregnancy are some of the causes for anemia in our country and why it is so prevalent. So the moot point now is, if we've had a program to reduce anemia for the last 50 years, why are the statistics so dire? Why is this problem not being addressed in a manner which would be satisfactory? And what can be done so that we can remove anemia in our country? These are some of the questions that we will be taking up in this show. Please welcome Dr. Rahul Bhargava, Director and Head Hematology, Hemato Oncology and Bone Marrow Transplant, Fortis Memorial Research Institute, Gurugram, who is now joining us. Welcome to the show, Dr. Bhargava.
Thank you, Anisha. Thanks for a warm welcome. And actually speaking, you have laid down the foundation for anemia very well for this talk, I would say. Well-researched thing which you have done. Very concise.
So Dr. Bhargava has been spearheading the functions as a director and the head of hematology, Hemato Oncology, and stem cell transplant at Fortis. He also works with school children in Haryana and has been, monitoring their health about 1,000 school children in Haryana. Dr. Bhargava, anemia, people only think about, pregnant women, so give them the folic acids. As a pregnant mother, I took the folic acid and the supplements that the doctor told me. After pregnancy, nobody cares. Even moms are too busy with their children and they just forget taking the supplements. Plus, for children, the doctors do recommend after a point of time to take a few multivitamins if they feel that the child is pale. And then, getting your kids to take any medicines is so tough that you forget about it. Is this a problem? Is this one of the reasons why we're not able to address anemia properly in our country?
Anisha, so if you go in the historic perspective, we need to understand that fact that we have never been trained to think about our own health. Okay, leave aside everything. So today, screaming headline in Times of India and Hindustan Time was 75 million people in this country are having over 60 years of age, are having chronic diseases like hypertension, cardiovascular diseases. And then one beautiful guy on Twitter wrote, 1/5 elderly above 60 years of people have got mental health. So this country has gone the wrong way. They have reached onto the top first rather than addressing the bottom of the pyramid, which is like anemia. So mental health could very well be a part of a bigger strategy, but neglecting anemia in this country is really, really leading to a problems of what we are seeing today of a mammoth task. I mean, a scale where like 55% people are anemic in this country. Half of them, if I keep on going to the Huda City Center, which is just next door to Fortis, and if I just randomly pick people coming from Metro and I ask, what is the normal hemoglobin in India? They will say 10. 10 ka dam. 10 hai to bas hai. So I can tell you the awareness factor within the public is so low that the normal values have been long forgotten. And until unless we don't know what is normal, we will never be able to achieve what we desired for and what is the ideal hemoglobin level. So in America, there's an incidence of anemia is 5 to 10%, and that to be predominantly in Asian African country, natives of Asian African origin. In India, it's 55%. Urban females like you and me and my wife still has got 30% females who are anemic. So I'll give you anecdotes. 1.5 years back, every day I used to get scolding from my wife. I was an obedient husband carrying flowers, cakes for my wife, but nothing was soothing her. Then one fine day, as a hematologist practicing for 14 years, I decided to run a test on my wife and I found the hemoglobin to be 8. Gave her iron supplementation, and since then I don't reach home, she is not angry with me. You see? So the beauty of correcting the anemia is that by the end of the day, do you feel weak, fatigued, and tired? We have long forgotten. We think it's the boss. Either it's a maid which is not coming, our driver is not doing well, and everything is perfect fine, then the God is not with us. But we have never thought that all these problems could have been within myself as well.
That is true, Dr. Bhargava.
Low hemoglobin.
Yeah, everybody, because it is not seen as a disease, because it is not very serious or seen as serious.
Because we have never been taught that way. So I would say in our schools, we have never been taught how to sneeze. Thanks to COVID, at least we have started sneezing in our armpits, or at least with a mask on. So the problem is in India, if we need to strengthen the country, what we need to do is build the base strongly. And that is where anemia is a major component. So you have very well said the hemoglobin in females has to be 12 and it has to be more than 13 in males. But what is the upper limit? 16 and 16.5. Even if they go beyond that, then it's a problem. So Anisha, the biggest thing is the awareness, and that's what you're doing, that anemia is a problem. And it's a gateway for multiple disorders which you can diagnose, like thalassemia, like celiac disease, having a diarrhea, ulcerative colitis, malignancies, colon malignancies. In elderly side, it could be myelodysplastic syndrome or myeloma. So you see, you can actually, by knowing what is right and what is wrong, what is desired and what is ideal, you can actually reach on to a diagnosis. And that's what the country needs, early diagnosis. Healthy individuals where they can work twice their capacity, because we have to catch up. We were preterm babies. We are 73 years old. We are preterm babies. We need to catch up with Americans. We need to catch up with Chinese. And how will that come up? By working, increasing your efficiency. So what I would suggest through your channel is, guys, whosoever is listening, please understand that anemia is a major component of decreased productivity. That's where females who are doing, and anemia is all being linked to anemia. I mean, anemia is being all linked to females in this country. That everything, oh, anemia, वो तो मेरे को नहीं हो सकता. मैं तो जाट हूँ, हरियाणा का, दूध दही खाता हूँ, मुझे नहीं हो सकता. I mean, guys, दूध dahi does not contain iron. Please understand that fact. Anything which is white does not contain iron, including the American. Okay, so white is not good for iron deficient anemia patients. So my humble request to you is, these awareness sessions actually reaches to the masses in telling that hemoglobin महिलाओं में 12 और पुरुषों में 13 होना आवश्यक है.
Okay, so the first point is that we need to set the ground to tell people that what is the normal anemia, hemoglobin level, and why it needs to be at a proper level. But what I want to understand from you is that if my hemoglobin is low, what is the solution? Because here half the population of our country has low hemoglobin. Now, for 50 years, the government has a program of giving supplements, and it's not really made a big dent. We've seen a drop in states like Assam, but it's still a significant problem. When they have a program to give the supplements, it's still not working. Is this the right approach?
Anisha, the thing is, where is the participation of the public as well? We can't leave everything to the government, isn't that? Can we? Where is our own participation? Where is our own understanding about our own health? Do you feel weak, fatigued, and tired by the end of the day? Do you feel lightheaded? Do you feel tired all throughout? We are predominantly a vegetarian population. Have you ever thought it's just not iron which is contributing to the low hemoglobin? It could be vitamin B12 which might be contributing to it. And our national program only tends to supplement iron with folic acid and not the B12. And our predominant 70% population is anemic. I mean, vegetarian. I consider even chicken. Whosoever consumes chicken also is a vegetarian because it only gives you protein. Okay, so only people who eat fish and red meat are considered as non-vegetarian, definition-wise. Okay, so the thing is, the most important thing. So most important thing is the country which has got a predominant vegetarian population, the country where we are not supplementing vitamin B12 without knowing that there could be thalassemics, without knowing the cause of that. That's the reason why we have not been able to reach to our desired goals. We have forgotten our own tradition. वो जो लोहे की कढ़ाई होती थी, जो दहेज में मिली थी मुझको, वो तो पता नहीं कहाँ चली गई. We have all
now
lost.
Everybody's on to non-stick and things like that.
Exactly.
That's right. We've forgotten our copper katoris and our iron ki kadai.
Right. So the thing is, we have moved away from our tradition. We have not been able to fortify our food with iron because we are very, very taste sensitive people. Okay. In America, even the orange juice is fortified with iron. Even the late chips are fortified with iron. And India, that is nothing. So we don't feel that there should be an iron fortification of these foods because kids are taking it. And at least if they are taking it, some form of iron is going inside the body. So multi-pronged approach is required to bring the best and eradicate anemia. So anemia eradication program, but just writing that anemia free, anemia mukt Bharat is not going to make us Bharat mukt, or anemia mukt Bharat. What is required is your own participation. So tomorrow, Anisha, you feel weak, fatigued and tired, you feel irritated by the end of the day, or you suddenly start taking offs from the offices, okay? You start feeling tired throughout the day, or you start feeling low, you don't feel like eating, you feel like eating clay, you feel like eating ice, then the body is giving you the signals. Please, guys, whosoever is listening to this whole program, body tells you before it becomes sick. It is never that it will suddenly fall sick. It tells you. It tells you that it gives you a signal. When there's a tolerance debate which comes in, that we are a highly intolerant country, I say we are the most tolerant country. That female walks into your office or male walks into your office with a hemoglobin of 4.5 and say, Doc, I was just feeling light-headedness and I thought, let me get some blood test done. And surprise, 4.5. I said, yeah, that's what you have been going around for 6 months with this. And this is a chronic anemia. So body is adaptable. Body is malleable. Body is expandable. It adjusts to the scenarios. So guys, hemoglobin of 12 is what is required. And that's the most important thing for all of us to understand.
Right. So Dr. Bhargava, I think the only time when people start reacting is when they faint, when they pass out.
Yeah.
The regular tiredness is just seen as regular tiredness. It's not, nobody connects the dots. So where would you suggest people stand up and start taking notice that something is amiss?
So I would say my kid keeps on fainting on and off whenever he sees the maths results. Okay. So every 3 monthly or 4 monthly, when his maths result comes, he faints. So apart from that, if it is like you start passing out, you feel lightheaded. As I said, you feel dizzy while walking. You just cannot walk. You cannot walk. Wake up early in the morning. You're not able to eat well. You're having a gastritis, abdominal pain. You're having a muscle fatigue. One of the commonest symptoms where people say is that whole night there's a restless leg syndrome where you're turning and tossing on your bed with a leg pain in the calves. That could be the reasons to go to a hospital. That would be the reason to get a simple blood test called what is called complete blood count. And I would request and urge people to send it across to you so that you can send those reports to us, which take 5 seconds. So I remember I have a consultation of 800 rupees in Fortis. So this guy enters and show me the report. Within 5 seconds, I make a diagnosis of IDA. And he starts fighting that you have not given me enough time. How can you make a diagnosis in 5 seconds? So guys, the CBC report over a period of time, and a veteran like us can make a diagnosis within 5 seconds at what you are suffering from. So please do your CBC, send to Anisha, and she can send it across to us to get a consultation so that at least we start moving ahead. And more importantly, anemia is the gateway. Understand that fact. You might be from a particular community. You might be from a particular caste. You might have migrated from Pakistan. You might have a thalassemia. So thalassemia hemoglobin remains 9:11. And often these pilots from various communities comes to us and get for their recommendation that they're fit and fine to fly because their hemoglobin has been 10 all across since they're born. They will die with a hemoglobin of 10. Are they suffering from iron deficiency? No, that could just be thalassemia trait. And once you get married, and we know love has got no boundaries, it has got no religion, it has no caste. So you can fall in love with anybody. And once you fall in love, you don't ask whether, oh, you have a thalassemia trait, should I fall in love with you? Or I just see you and I fall in love with you, that's all. And the later things comes later down. If from a conventional family you will go for a Janam Patri, I would say along with Janam Patri, please go for a blood Patri also, because you and your husband or a spouse is as a thalassemia trait, there's a 25% chance that the baby born could be a thalassemia major, where you can start the blood transfusion from the age of 6 months, continues for next 20 years and 30 years just to see your child die. That's awful. This is awful. Who is responsible? We were responsible. Why? Because we didn't got the CBC test done. Because we never were taught about that. We were not aware of that. So that's why I would say 2 years back, this same chilly December, I was sitting in opening of multiple matrimonial websites, Shadi.com, Second Shadi, Bharat Matrimonial. And my wife freaked out at 12 o'clock midnight. What are you doing? I said, I'm trying to put the coupons for thalassemia screening. Whosoever visit these portals, they know about thalassemia, because these days, many marriages happens through the online portals. And that's where your coupon has to be there, or awareness session has to be there, that you need to get your thalassemia checked up. So see, guys, once you start getting to know your body, you start understanding that. There's a reasoning behind what we are.
Right, Dr. Bhargav, let's come back to anemia. Now, you say that you can diagnose it in 5 seconds if you have the CBC report with you. Now, we want to understand that so far the government has worked on a preventive level, that we will start supplementing everyone so that we don't have this problem. Now, you said fortifying food could be one of the ways to ensure that these micronutrients are consumed by women and children. The government believes in supplementation, and like you said, B12 supplementation may be missing, and that's why it hasn't worked. The other problem is, or the other solution could be just plain diet, an improvement in diet. But there again, we have a challenge because, hunger in India is quite high. The government has a midday meal scheme where they are reaching a large proportion of children and getting them to schools, and the children go to schools because they get a meal. So could we do something with all these three: fortify your food, increase supplementation, your diet by midday meals, so that the burden comes down of the deficiency of iron in our country?
Anisha, of course, this is a 360-degree effort. None of the efforts alone will be successful in eradicating such a major problem. It's both communication to the people, what to eat and what not to eat, what can lead to a problem. With supplementations, you can have diarrhea, you can have black tongue, जिसे अपन काली ज़बान कहते हैं. In a particular village, if you're taking iron, you can develop a coating of the tongue, and that could be black or brown. So the important thing is, all the three things has to go parallelly. They have to be in synchronous to eradicate this problem, to reach to a population which can break the poverty cycle. Because the most important thing is, the moment you are anemia free or your hemoglobin is 12, your working efficiency, your concentration capability, your intellect increases by many folds, so that you can work. You can work smartly. So one of the reasons for inefficient work force could be the hemoglobin being low at the initiation of the life, which could be at the time when patient was conceived. That's why they say 3 years of gap between, minimum 3 years of gap between the child. Second, once the baby is born, the supplementation has not been adequate, so that he has gone into suppression of his mind activities so that he cannot perform the most intellectual task which is desired of. And third, patient might just having something else. It's just not iron deficiency anemia. It could be vitamin B12. It could be thalassemia. It could be celiac disease. It could be another problems or blood getting destroyed. So important issue is once we know your hemoglobin is low, then only the second question is asked is what is the cause? And the third is how to do it. The first thing is, am I anemic? First, we need to ask that question. In females, we did a survey in Haryana. 80% of females, when they have a menarche, they have got no clue what is high bleeding and what is low bleeding, what is normal bleeding. You see, in females, all the comparison of a menstrual cycle bleeding is from their mother or grandmother. Still in India, if I ask females, what is called as heavy bleeding, changing 3 pads in a day, 80 ml of blood, 5 to 6 centimeter of a clot which you are passing. And that is like, if you ask in rural, it just goes on 5 to 7 days. That could be the cause of anemia. And they will not open up until unless you are a female or you have a gynecologist with you who's a female. So friends, it's a multifactorial thing. In females, the most common thing is menstrual cycle abnormality. In males, it is nutritional problem. In urban areas, tobacco chewing can also lead to low hemoglobin. And if we move on from the age of 0 to 18, 18 to 60 and beyond 60, beyond 60 years of age, the cause could be the cancer itself, the cancer of the intestines, cancer of blood cancer, which is like myelodysplastic syndrome or multiple myeloma. These are fancy words. But the whole idea is once you know what is abnormal, you will seek an answer. And once you seek an answer, the doctor will reach to the right conclusion.
Right, but Dr. Bhargav, preventive healthcare is only perhaps an urban phenomenon of very health conscious people. People are not going to go and get their blood test done, even if until they're fainting or falling off. Most of this is the attitude that we have towards our health. So you said the first step 0 is to find out what's wrong. By
understanding your own health. Understanding your own body, that this
but
is
Dr.
the body
Bhargav,
God designed.
should we keep waiting till then? Should we preemptively start supplementing and fortifying food? Wouldn't that be better?
Of course.
Can we just leave it to people? You figure your body out. If you feel something's amiss, then come get a blood test, because that's not working.
It's a very valid point, but I don't have the resources to go and preemptively give 135 million people iron tablets, because the most important point is that half of them will be going to the washroom more often than not. You will be 30% people with iron supplementation lands up having an abdominal discomfort, and that's where they stop doing
Taking
it.
the medicine. Okay.
They just get wary of the fact that, oh, I'm going to take this tablet and I'm going to have a loose motion. They just stop. So communication is very, very important. That's why the small amount has to be fortified. That's why the iron utensil has to be brought in. That's why jaggery has to be brought in into your own system, which we have long forgotten. The idea is, again, the government is there. Everybody is there to support. The first contact is you yourself, with yourself. Start understanding and respecting the body, which I've seen post-COVID, people has actually started respecting their own body more often than not. They value more their cars rather than their own body. And all the budget expenditures are unexpected. They're not accounted for in any accountancy of your home budgets. So any health expenditure is never accounted for. They are all unexpected. So my friend, most important thing is body gives you signs before it actually goes down the drain, before actually it breaks down. So listen to your body.
Right. So Dr. Bhargav, if we talk about, if somebody wants to preemptively work to ensure that body is in tip-top shape and all functioning is optimized, there are a lot of dietary myths as well. Somebody will say, oh, non-veg is not good, vegetarian way or vegan way, or this is the good way to go. Somebody will say, avoid dairy because lactose gives you issues. So there are a lot of myths that have come up with diets as well. So, what is the way forward? And what should be the dietary advice? Can we improve diets to reduce the burden of anemia in our country?
The first of all thing is these are all myths. Whatever suits you, please eat them. As long as not putting weight onto your body, okay? And eat in moderation, not in extremes. Neither eat or eat and gobble up everything in next 2 hours. So go slow. No diet has been proven superior over the another in a normal, healthy lifestyle. If you have gained weight, if you want to lose weight, then all these fancy diets works in. But in keeping everything in moderation between the red meat and the other things, everything looks good. So I would suggest to you is please don't fall into vegan diet or lactose. I mean, I might just be intolerant to lactose because my mother has fed me milk left, right, and center for years together. And since then, I've went to medical college. I've never had a milk again. I said, okay, enough of 18 years. My mother had fed me morning, evening with Bonvita and other types, Horlicks. But does milk contains iron? So your stomach has got a 2-liter capacity, and 1 liter you take milk. What will happen? Will you get anything?
You will not feel hungry for nutritious food either. You will just.
So the thing is, so don't go for a balanced diet as shown in a moral science class. In class 8 and 9, you are already shown what is balanced diet. Some yellow vegetables, or yellow dal, green leafy vegetables, some carrots, some this, that.
Red color.
Have a balanced diet.
And what about those who are primarily vegetarians, a large portion? Even if I'm a non-vegetarian, I don't eat non-veg food daily. Then what do you do?
So I think for a vegetarian, the most important thing is the I would say green leafy vegetables, paneer, which is a good source for vitamin B12, which needs to be taken. But the strength of a vegetarian is the vegetables and the dal. So dal has to be the ingredient point into your system. Chola, rajma, all these beans, they help you. They are rich source of vitamin B12. So please do that.
Okay.
And please spend some portion of your expenditure on fruits as well. That too, banana, cheaper ones, banana, papaya, which takes care of your constipation also. At the same time, provides you micronutrient as well.
Right.
So very, very important to spend on the fruits as well.
And what about cooking mediums? Do you think going back to using iron kadai or for iron tawa? That
in Ranchi it was done. The experiment was done, and it was shown that the moment you start using iron utensils, it becomes better. So I would suggest please go back to your own traditions. So the food might look slightly blackish, but black is beauty. So understand that.
Right. What about fortification? If you speak to food manufacturers, they really don't have a problem in fortifying food, especially the packaged food, or even food like atta and the regular multigrain atta or normal atta. Most of the food producers, even oil manufacturers, don't have a problem in fortifying the food. Should there be mandatory guidelines laid down by the government? Could that be a way forward?
Oh, fortification will go a long way. That's one of the ways definitely to serve the population at large. And that's what the government is also trying. So they have tried with edible oils. Let's see when it comes to atta and rice and other packed foods. But yes, that's a way to go forward. And fortification is not going to change or alter your taste buds, believe me.
Okay.
It's good. In America, you eat whatever it comes by. They're all fortified with iron. And you never raise your voice. It's only once moment you're back in your home, you want everything perfect. And perfect will only come when it is iron fortified.
Okay. And when it comes to the supplementation, do you think that, if the government has a midday meal scheme, can it give supplements to students so that, preemptively, we can ensure that...
going on in many of the states is going on. The preemptive methodology of increasing the productivity and efficiency is going on by supplementing the iron and taking the hemoglobin up to 11 or 12. But again, the major important thing remains is the cause. we should not see the masses. We should also see that each and every individual gets benefited out of it. So those people who are not getting benefited of iron juice or so and so forth, or iron supplementation, please have to contact their doctor to understand that they might not be suffering from iron deficiency anemia, but they might have something else, and which could be thalassemia, which could be anything. So don't delay your symptoms. At least take the shot by asking your doctor.
All right. The other thing is that, the prevalence of anemia in our country among women is very high, starting adolescence onwards. Now, one of the major issues is the fact that women's health is not priority amongst families. Women's diets are not a priority amongst families. They usually last to eat. So, how do we, come around this problem?
Awareness
if you
remains
tell a
awareness remains the cornerstone. So important thing is making people aware about anemia, making people aware about the symptoms is what is going to build them a narration that they need to go and meet the doctors. As well as I would request all the doctors for these anemia workups, they should be doing free. At least the consult, that's what we have started. We have got a package of 200 rupees where they get a consultation with a doctor also free and a dietitian also free, along with a blood test. So I think please avail these kind of the benefits of the expanding healthcare system so as to make every citizen of the nation healthy and of course anemia free.
Right, but Dr. Bhargav, to have most of your communication directed at women because they're seen as those carrying the burden largely in our country, or even children, is that the right way to do the messaging? Or you need to tell families that your daughter-in-law is not just above the maid. You need to give a proper respect and give her good food too. Because if you tell a new mother or an expectant mother that you gotta do this because it could affect your child, the woman will certainly do it. But who's gonna look after the woman once the child is born? So the messaging and the communication is important, but it doesn't have to be on the women only.
So I think beyond the communication is the I would say compassion towards your own body and upon your own family, because you have to understand the female and the male are both equal. Are they made equal by the God? And they're all equal in all their capacity and capabilities. So I would say it's a large scale moral changes what is required in the society as to reduce the burden and make the country healthy and prosperous. That's the most important thing. If you understand that fact that yes, if each individual is healthy and anemia free, they will be able to contribute to the society as well as to the nation more. Varieties will start setting in. We are still going after mental health. Of course, it's a problem. I would not say it's not a problem, but not addressing anemia and only talking about mental health is going overboard a bit more. I would say that way, because the most important thing is anemia might just be contributing to the depression and other things, because inability to perform things, inability to get up of the from the bed and not able to do your routine course. I think that's where we start lagging behind, and that's where the self-guilt leads to the problem. So I think it's a more of a comprehensive structure which needs to be brought in for the females, and the female needs more awareness through your section and through your communication that they need to come forward and take off this myth by, not the myth, but take out this statement that the 55% females in this country are anemic. They should be able to do that in by 2025, saying that, okay, we were 55% in 2020, but let's see, it comes to 5 to 10% by 2025. So we need the participation of all you people to eradicate anemia and understand anemia and help in developing the right protocols for our own people.
Right. So you had mentioned green leafy vegetables, dal, they were good sources of micronutrients, right? Now, I just wanted to check with you, what are the foods to
milk does
avoid?
not have iron.
Milk have...
Understand that fact. Anything which you take with a tea does not have iron. It gets chelated. Okay, so avoid taking tea after having a breakfast or a lunch or a dinner where you are taking iron supplementation. Once you are taking iron supplementation, you have to avoid tea, milk, and green leafy vegetables during that time when you're taking oral medication. So jaggery is a rich source for iron, which you need to remember. Sugarcane again is a rich source of iron. So these are smaller things which are available across the length and breadth of NCR and so on and so forth, and the rural heartland. Jaggery is very, very important for these people to have.
Right. And what are the other things that they should keep in mind? Because, taking iron supplements could also bring changes that, stomach upset could be one. So they should also be aware of these side effects. So would you just list those out for us as well?
So predominant side effects of iron supplementation is constipation, abdominal pain, or certain times nausea and vomiting. These tablets can be taken alternate day, which is a good enough reason. Tablet, iron supplementation, anything can be alternate day also if they're not able to tolerate on a day-to-day basis. But alternate day will reach to the benchmark of hemoglobin of 12, starting from 8, will be another 2 to 3 months. So that is where new technologies are coming up, new technological advancements in drug delivery is coming up, and the IV iron, which has reduced the side effect, has becoming more popularized within the pregnant females. So these are the ways we can actually eradicate anemia. Know the cause, give iron supplementation for 3 to 6 months, and finish it off.
Okay, so there's an easy way to tackle this problem should you become aware of it. And this is our attempt to create the awareness. Do not take your health lightly. If you feel that you're tired by the end of the day, get your blood test done and get it checked out for anemia. This is an attempt to increase awareness about the prevalence of anemia in our country, which is very high, and we need to reduce it as soon as possible with all these multi-pronged steps that can be taken. Dr. Bhargava, thank you so much for joining us today and talking to us about anemia in our country and what needs to be done so that we can reduce the incidence in our country. We're grateful for you for joining us today. Thank you very much.
Thank you.
So that was Dr. Bhargava answering all your questions on, talking about anemia and telling us what should be the best strategy to reduce its incidence in our country and be more mindful of our own health so that we can catch problems early. We need to have improved supplementation, we need better diets, and we need fortification so that anemia in our country, the deficiency of iron in our country goes down. We hope you've liked this show. Don't forget to follow us and stay updated on all the concerns of your health and well-being. This show was supported by Shilpa Medicare. Do keep sending us your questions, your suggestions, your comments. They're good feedback for us. They motivate us to do more. Stay at home, stay safe. Goodbye, and we'll see you again soon.